Good morning, everybody. Welcome back to join us in this week vaccine talk. Today we are going to talk about pneumococcal disease, and we have someone new to join us today, and this is Dr. Jolene. Hi, Dr. Jolene.
Hi everyone, it's such a big honor to join all of you all today.
Okay, so what is pneumococcal disease?
So pneumococcal is an infection of the lung. It's a bacterial infection caused by the bacteria named Streptococcus pneumoniae or pneumococcus. It's infection of the lung and is one of the most commonest bacterial strain. Back in 2016, statistics shows that is third leading causes of death in children under the age of 5. And pneumococcal can be transmitted by person-to-person contact with direct contact with respiratory mucus such as saliva, phlegm, or mucus.
Okay, pneumococcal disease，我们华语学名为肺炎球菌症。顾名思义，肺炎球菌症是因为一种名为肺炎球菌的细菌而引起的。它们大致上普遍上会造成一种都会造成肺炎。在2016年的数据里显示，我国小于2岁的孩童的致死率是排行第三的，肺炎是排行第三的致死率，而他们是通过唾液的传染和跟呼吸道的粘液传染。就比方说，如果某人患上了肺炎球菌症，他身边有亲密接触的人都有机会感染肺炎球菌。Sounds dangerous, and may I know who is at risk of getting this kind of infection?
There's two particularly groups that is at risk of getting the infection, which is children under the age of 2 years old or elderly that is older than the age of 65 years old, where they have more slower immune system, or anyone with a following medical problems such as immunosuppressed illness, patient with HIV, for example, diabetic, or cancer patient who is receiving chemotherapy. Also, patient with chronic illness such as the heart patient, liver, kidney, or lung, including asthma and chronic obstructive lung diseases, are more prone to have pneumococcal infection. And also, patient who has undergo any operation over the facial or head region which has cochlear implants such as cochlear implant, or anyone with leaks over the brain fluids.
谁会属于高风险群呢？其实小于2岁的孩童跟大于65岁的老年人都属于高风险群。除此之外，还有特定的群组是属于高风险群的。第一就是免疫功能低下者，就比方说如果你是癌症患者、糖尿病患者，又或者是艾滋病患者。还有第二，如果你有肺部的疾病，就比如说哮喘、慢性慢性阻塞性呼吸道疾病，或者是你是长期的烟民，你也有几率患上肺炎球菌症。还有的一些人，如果你有植入人工耳蜗的话，这3种类群都属于高风险群。So is there any complication from pneumococcal disease?
Yes, most of the pneumococcal infection are usually very mild. It's just a lungs infection which is treatable. However, that can be deadly or result in long-term problems such as brain damage or hearing loss. Or there's actually 2 fatal complications such as which can occur, such as infection of the brain, which the doctor will normally call meningitis, or when it runs into the blood and infect the blood, which we call it as bacteremia, infection of the bloodstream. So these 2 complications are usually more fatal, which means it has higher chance of death for children younger than 5 years old and also elderly patients.
其实有些人就会开始担心，如果感上了肺炎球菌症，那该怎么办呢？但其实你不需要那么担心，因为大部分的疾病，大部分的肺炎球菌症都是属于轻微的，但有少部分的人会产生一些比较严重的并发症，就比如说脑膜炎跟菌血症，这些比较严重的症状都属于一些因为免疫功能减低的人。
So this is an example of how your lungs will look like when you have lung infection. as particularly when you have a pneumococcal infection. You see all the white patch is actually that where's the infection is going on.
Okay. Okay. Is there any treatment for the pneumococcal disease?
Treatment for pneumococcal usually is supportive and early treatment with antibiotic. However, like old man saying goes, preventive is always better than cure. So prevention can be effectively done by pneumococcal vaccine and is always available in Malaysia.
肺炎球菌症的治疗方法大致上我们分为支持性治疗与抗生素的使用。但俗语有说预防胜于治疗，我们还可以通过疫苗的注射来有效的减低感染肺炎球菌症。
So question may arise, if we had treatment, why are we going to get a shot of vaccine? And many of us say vaccine do comes with some complication itself. So in study in 2019, which cover our country and also our neighboring country, we found that the most common type of infection is usually infection of the lung. And out of all the type of infection of the lung, pneumococcal accounts one of the top causes of infection. And also we found out the types of pneumococcal infection in Malaysia are usually coverable by the vaccine, which is the serotypes is coverable. It also shows that from the study that there is a higher antibiotic resistance has been going on around. What do we mean by that is actually because of the use of antibiotic widely used coverage, the antibiotic become less effective or less strong to combat or to actually effectively eliminate the bacteria, which means the bacteria now is actually more strong compared to your antibiotic.
Okay. Thank you, Dr. Jolie. 其实有些人还是会疑惑，既然我们可以用抗生素，为什么我们还需要接受疫苗的注射呢？其实，在一项2019年里的研究显示，大部分的感染性疾病都是属于肺炎，而在肺炎的病列里，肺炎球菌症属于大部分。所以，其实如果你注射了疫苗，你就可以有效的减低感染肺炎的几率。除此之外，长期的抗生素使用会导致细菌对抗生素的耐药性增加，从而导致抗生素的功效减低。如果你长期或者是反复性的使用抗生素，会造成你身体的细菌对抗生素的免疫，从而让抗生素失效。So Dr. Jolene, do you mind tell us more about the pneumococcal vaccine?
So like I say, pneumococcal is preventable by vaccine. There are total 90 types of Streptococcus pneumoniae found in Malaysia, and we have 2 types of vaccine available. We call it pneumococcal conjugated vaccine, or short you can call it PCV13, or pneumococcal polysaccharide vaccine 23. In short, we can also call it PPSV23. Both vaccines are available in clinicals, and if they are actually caters to different types of patient. So if you had any question regarding on the vaccine, do always come back to find us, call us up to get more information, or you can discuss further with your physician or pediatrician.
肺炎球菌症的疫苗在市场上被分为普遍的2大种类，就是 PCV13与 PPSV23。这2种疫苗呢，都是会针对不同的年龄群而给予的。Okay. What is our current recommendation by Ministry of Health in our Malaysia?
There is actually talks around our Malaysian government that will mandate the pneumococcal vaccine for all the newborns from the year of 2020. But at the time of this talk, it will still haven't carried out yet.
其实我们马来西亚卫生部目前正在计划强制性的让新生儿接受疫苗的注射，但是它还属于计划的阶段，还没有真正的实行。Okay. Is there any side effect after taking the vaccine?
Could be one of most important questions,
Yes.
right? So both vaccines are generally very safe. So the side effect is actually the same for all type of vaccine, which is redness, tenderness, swelling over the site of injection, low-grade fever, and also allergic reaction.
OK， 如果你担心的是疫苗的副作用呢，其实2种疫苗都是非常的安全，但 就像普通的，就像一般的疫苗，它就会有少部分的人会产生一些红肿的反应在于那个注射的部位，或者是会有短期的发烧，还有一些人会产生一些过敏的反应。Since is there any contraindication or any special circumstances that we shouldn't take the vaccine?
Okay, please do take note that if you have any allergic reaction to previous dose of vaccine or any component of vaccine or allergy to vaccine containing diphtheria toxoid, please do consult your physician or pediatrician if you are allowed to take the next dose of pneumococcal vaccination. And if you are having any acute illness such as upper respiratory tract infection like common cold, flu, fever, please do delay your vaccination and discuss with your physician for the next course of the vaccine.
如果你在之前的疫苗注射里，或者是你在注射百喉症的疫苗时，你产生一些过敏的反应，你就必须注意如果你想再接受疫苗注射，你就必须注意，你可以询问你的主治医师或者是你过来你可以欢迎到一个医院与详细的解释。OK， 还有如果你在计划疫苗的注射时产生一些急性的疾病，就比如说发高烧，或者是上呼吸道感染，你就必须延迟你的疫苗直到你完全康复为止。
So if there's any enquiries or any question that you would like to ask us, do always call us up and you can always ask us any question. We will be grateful to help you from there. Thank you. Question.